I just want to share with you that when you see the work, I'm not doing just trigger point work. I'm going to be doing many unintrusive techniques for headaches, and I will start at the skull and the face. It is a must to always start the work with a person with a headache at the skull and their face, okay? So as Constance shared with us, her headache starts right at the right eye, at the Orbicularis Oculi, close to the corrugator and the procerus. So I'm going to do some work related to that. When I work with headaches, I start the work at the face and the head. And then I go towards the cervical spine and then back and forth. And so you're going to see me doing some work supine and some work sideline. Another thing that I already spoke with Constance is that at any time she can stop the session because of what I share on the assessment, we share, I should say, which is the fear of actually having the headache, which is why that I start into the head. So I'm going to start here at the temporalis, and the fibers go into this direction here. You guys, you all know that. So I am using and working into both sides a good amount of flat touch, palpation, right? How's it feel? Are you okay?
Oh yeah, feels good.
Is it tender?
The last point that you went on the right side.
Yeah, right here.
Yep.
Okay, and then right on the fibers, they go in the horizontal. So I'm going to go toes to nose. The left is a little bit more tender there, isn't it? Or is it hard to say?
It's hard to say.
It's hard to say. So anything I do, again, if it is too much, please let me know. I'm going to work right here onto that third, the frontalis. This is a muscle that helps us when we are afraid, you know? And also helps us when we do facial expressions in general, you know? Sometimes to read. And then this is the muscle that we have the lines of wisdom. How you doing here? Are you okay?
Oh yeah, I'm doing good.
Is this too much?
No.
Does it feel tender how you sometimes feel a headache?
Like I can feel a sensation, but I wouldn't say tender.
Okay, but you feel the sensation like if it is the headache, right?
Yeah.
Okay. Okay? I'm going to go right onto that third eye.
Okay.
Now, how is that pressure?
It feels good.
Does it feel like I'm touching your brain?
No.
Sometimes for some clients it does. So I'm doing the work right onto the corrugator, and so my index is pressing down towards the table as my middle finger is going towards the eye socket on the skeleton, okay? So I'm going to go right here onto the Orbicularis Oculi, and I'm going to hold on. How is that? How tender is that?
That's like a 2.
A 2. And that is the portion that bothers you, right? Does it feel like a bruise?
No.
Does it feel good?
Yes.
What you need is unintrusive strain counterstrain techniques for you not to have the rebound effect. Okay, let's see if this is going to help us.
Yeah, it did go down. It's still there.
Yeah, it's still there, but it went down, right?
Yeah.
Yeah. So with you, my friend, I'm doing strain counterstrain in between everything. Everything. So I'm going to do another one now, okay? That is the idea. So I'm going to place the head into a gentle, let me know if this is comfortable. I'm going to bring the frontal bone into this direction and the maxilla towards it. And I'm going to do in both sides and ask her which one it feels better. What does that mean? Which one relieves it?
Okay.
Okay? So, or let me know if it creates it. Now, this is the direction.
Okay.
And now, this is the direction. I think, which one do you prefer?
This one I feel more pressure. The other side I feel...
Relief.
Yes.
She prefers the other one. I'm looking for the relief. Now, I knew you were going to prefer the first one. You know how? There's more motion this way than that way.